Make sure that the undersleeve covers the heel and is always wrinkle-free. In case of donning a lower leg garment only, the undersleeve should end above the knee. Place the garment just below the knee crease and attach the top 2 bands loosely to hold the garment in place. The bottom of the garment should be positioned just above the ankle bone. Attach the bottom-most band with firm and comfortable tension. Attach the bands alternately from bottom to top so that the garment lays flat and wrinkle-free. Slightly pull the upper band upwards to avoid wrinkles. Hold the top of the garment while attaching the last band. If there are gaps or creases, simply readjust the bands. Each band should be adjusted to the compression range determined by your therapist at the initial fitting. Use the provided card to identify the applied compression level. The distance between the lines on the band is equal to the compression pressure on the scale of the card. For an effective therapy, readjust the compression throughout the day. Lastly, fold the undersleeve over the top and bottom edge of the garment. Roll back the bands to keep the hook fasteners lint-free. Make sure not to detach any of the spine tabs